When parents first hear the word neurofeedback, I usually get one of two reactions. Either they've never heard of it at all and they're curious, they want to know more, or they've heard of it, they're intrigued, but they're also a little skeptical. And I say a little skeptical because it sounds almost too good to be true. And I understand both of those reactions. So today, in this video, I want to address them both with the kind of depth that actually helps you make an informed decision for your child or for yourself. So stick with me until the end. It's going to be a little long. By the end of this video, you're going to understand exactly what neurofeedback is, what happens during a session, what the science says, and how it fits into a comprehensive brain-based approach to ADHD. Hi, I'm Dr. Larthenia Howard, also known as Dr. Empowerment to Coaching Clients, and I'm a licensed marriage and family therapist, a certified neurofeedback practitioner, an ADHD certified clinical service provider, and former K-12 educator and school principal. I use neurofeedback as a core part of the ADHD support work that I do with children, teens, and adults through Anchor of Hope Counseling and Neurofeedback. And our services are available nationwide via telehealth. So regardless of where you're watching this from, this is a conversation worth having. To understand neurofeedback, you first have to understand something foundational about how the brain works. Your brain is constantly producing electrical activity. Every thought, every emotion, every movement, every moment of attention or distraction, all of it is driven by neurons firing and communicating with each other through electrical signals. And these signals have patterns. We call those patterns brainwaves. And they fall into different frequency categories, each associated with different mental states. So let me walk you through the main or the core ones. The first is delta waves. They are the slowest frequency associated with deep sleep and restoration. You want plenty of delta when you're asleep. You don't want it dominating when you're awake and trying to focus. The second is theta waves. They're slightly faster. They're associated with daydreaming, creativity, and drowsy state just before sleep. And again, theta has its place, but excessive theta activity in the frontal lobes during waking hours is one of the most consistent neurological signatures we see in ADHD, particularly in what's called the hyperarousal subtype, where the brain is essentially underactivated and seeking stimulation. The next are alpha waves. They sit in the middle range, associated with calm, relaxed, alertness. A well-regulated brain produces good alpha when it needs to be present, but not intensely focused. And then there is beta. Beta waves are faster. They're associated with active thinking, focus, problem solving, and engaged attention. Healthy beta production is what supports sustained concentration and task completion. And then at the high end, we also have gamma waves, which are associated with high-level cognitive processing and information integration. Now, here's why all of this matters for ADHD. In many children and adults with ADHD, we see an imbalance, particularly excess slow wave activity like theta in areas of the brain responsible for focus and executive function, alongside insufficient beta activity in those same regions. The brain, quite literally, is not producing the electrical pattern needed to sustain attention and regulate impulse control. And this is not a character flaw. This is a measurable neurological pattern, and neurofeedback is a tool specifically designed to help the brain learn to shift that pattern. Before we go any further, I want to acknowledge the efforts parents and caregivers pour into trying to help their children. And I know how discouraging it feels when you're doing everything you've been told to do and it's still not working. I saw this as a school leader, and I see it often in my current practice. So here's the deal. If traditional discipline strategies haven't produced the results you hope with your child with ADHD, that is not a reflection of your parenting, and it is not a reflection of your child's character. What it may reflect, on the other hand, is a mismatch between the strategy and the neurological reality underneath the behavior. Understanding that mismatch isn't about assigning fault. It's about finding a more effective path forward. Traditional discipline approaches, the ones most of us grew up with, the ones most parenting books describe, and the ones that schools are built around, are designed around three reasonable assumptions. And for most children, those assumptions hold true. For ADHD brains, each one requires a closer look. The first assumption is that a child can pause and think before acting. Most behavioral strategies work when a child feels an impulse rising, pauses, considers what might happen next, and then make a choice. That pause, as brief as it is, requires a well-regulated prefrontal cortex. In the ADHD brain, that window between impulse and action is significantly shorter. The impulse arrives and the action follows almost simultaneously, not because the child doesn't know the rule, but because the brain isn't able to access it quickly enough in that moment. This is a neurological timing difference, not a motivational one. And once parents understand this, so much of what felt confusing about their child's behavior starts to make sense. The second assumption is that consistent consequences will produce lasting behavior change over time. And this is one of the most well-intentioned strategies in the parenting toolbox. And for many children, it works beautifully. The idea is that when a consequence is applied reliably, the child learns to connect the behavior to the outcome and adjust accordingly. For ADHD brains, this connection is affected by something called reward pathway differences. The ADHD brain processes delayed consequences differently. What happened yesterday can feel genuinely distant to a child whose nervous system is wired to respond most strongly to what is happening right now. This doesn't mean consequences have no place. It means they work best when they are immediate, clear, and paired with regulation support rather than standing alone. The third assumption is that emotional escalation can be managed through firm, consistent responses. This one is important to understand with a lot of compassion, both for the child and for the parent in the middle of a difficult moment. When a child with ADHD explodes, shuts down, cries inconsolably, or rages over something that seems minor, it can look like, from the outside, like a choice or an overreaction. What is actually happening in that moment is emotional flooding. The ADHD nervous system escalates faster, it feels more intensely, and takes longer to recover than a neurotypical nervous system. The child is not performing, they're genuinely overwhelmed, more than likely, and their brain has temporarily lost access to the regulatory skills it does have. As parents, as educators, as anyone who loves a child with ADHD, this understanding changes everything. It moves us from a posture of needing to control the behavior to a posture of needing to support the nervous system first. And from that place of support, behavior does shift, not because we forced it, but because the brain finally had what it needed to access its own capacity. This is not about lowering expectations for ADHD children. It's more about understanding what has to come before the expectation can be met. And that prerequisite is regulation. I want to take a moment to talk about the school experience because for most families, that's where ADHD challenges become more visible and most stressful. And I want to speak to this from a place of genuine understanding because I spent years on that side of the equation as a classroom educator and as a school principal. So here's what I want you to know first. Most educators go into this work because they deeply care about children. Teachers are doing an enormous job under significant constraints, large classrooms, limited resources, competing demands, and very little training in neurodevelopmental differences. So what I'm about to share is not a criticism of schools or the people in them. It's context that I think helps parents advocate more effectively and collaborate more productively with their child's educational team. What sometimes happens in school settings is that the behavioral framework schools are built around, which works reasonably well for most students, can unintentionally miss what's happening for an ADHD brain. When a child with ADHD has repeated difficulty following directions, completing work, or managing transitions, the natural interpretation within a behavioral focused system is often that the child needs more consistent consequences or more structured redirection. And the educators applying that framework are genuinely trying to help. What brain science adds to that picture is this. For a child whose prefrontal cortex is still developing on a different timeline, the capacity to respond to those strategies may simply not be fully online yet. It's not that strategies are wrong, it's that the brain needs something additional. It needs regulation support alongside behavioral expectations. This is where parents can play a powerful bridge role, asking questions like, what does our child regulation look like before a difficult transition? Or are there movement breaks built into the day? This opens up a different kind of a dialogue than focusing solely on behavioral outcomes. At home, the most powerful complement to whatever the school is doing is this: regulate before you redirect. When your child comes home activated, overwhelmed, or already dysregulated from a full school day, that is not the moment for homework, battles, or behavior conversations. That is the moment for the nervous system to decompress first. A snack, some movement, some quiet time, whatever bring your child's system back to baseline. And once the nervous system is regulated, the brain can access the skill it actually has. The school environment and the home environment working together, both informed by an understanding of how ADHD brain works, is where children make the most meaningful progress. And that's exactly the kind of partnership we try to support through the work we do at Anchor of Hope Counseling and Neurofeedback. So if discipline alone isn't the answer, what is? And so here's where I want to be clear about something before I describe what we do, because I think this distinction matters. I'm not suggesting that boundaries, expectations, and structure don't belong in the picture. They certainly do. They absolutely do. But what I am saying is that the foundation has to shift. The foundation has to be regulation. And regulation requires understanding the brain first. When we lead with brain understanding, everything else, the structure, the expectations, the strategy, becomes far more effective because it's built on a solid foundation. At Anchor of Hope Counseling and Neurofeedback, the approach we use with ADHD children, teens, and their families is what I refer to as the ADHD Clarity and Regulation Pathway. It is a structured step-by-step process, and it is fully available via telehealth, which means we serve families across the country. So let me walk you through how it works. We start with the most important step, clarity. And by clarity, I mean real, objective, individualized neurological data. The assessment phase includes two powerful tools working together. The first is our brain mapping, a process called QEEG. During a brain mapping session, a comfortable sensor map or cap is placed on the head, and we record the brain's electrical activity across multiple regions simultaneously. The result is a detailed color-coded map that shows us how well different areas of the brain are functioning, how those areas are communicating with each other, and where patterns of dysregulation are occurring. This is genuinely one of the most illuminating tools available in ADHD assessment because it shows us the neurological picture underneath the behavior. We can see whether a child's brain is underactivated and seeking stimulation or overactivated and struggling to filter. We can identify which regions are contributing to attention difficulties, emotional reactivity, or impulse control challenges. And that level of specificity is what allows us to design a support plan that is actually tailored to that individual brain, not a generic ADHD protocol applied to every child the same way. The second tool is a computerized performance assessment that measures attention, impulse control, and activity level in real time during a structured task. Where brain mapping shows us the brain's electrical landscape, the performance assessment shows us how that neurological profile translates into functional performance. So together, these two assessments give families a level of neurological and behavioral clarity that is rare in most ADHD evaluation processes. Once the assessment is complete, we move into brain education. So this is where I sit with parents and, when age appropriate, with the child or teen directly and walk through what the data means in plain language. We talk about the brain, the nervous system, and exactly why certain situations are hard. This is often where the most significant emotional shift happens for families. When a child hears, maybe for the first time, that their brain is working differently, not defectively, something changes. The shame that so many ADHD children carry quietly begin to soften. And when parents understand the neurological picture, their responses at home naturally become more attuned and more effective. From there, we move into neurofeedback, the brain training component of the pathway. And using the brain map as our guide, we design a neurofeedback protocol specific to the child's neurological profile. Sessions deliver real-time feedback to the brain about its own activity, training it to produce more regulated, focused patterns over time. And because we use a home unit model, families can complete sessions from their own home, which is central to how we're able to serve clients nationwide through telehealth. Lastly, woven through the entire pathway is parent education, the insights from the assessment, the strategies informed by the neurofeedback progress, brain-based tools for responding to escalation, building regulation-friendly environments, and communicating in ways that reduce shame. All of that is part of what we build together. And this is not a traditional therapy. This is a brain-informed, data-driven, family-centered process. And the results family experience through this comprehensive approach are consistently more meaningful than what isolated sessions tend to produce. I get many questions about the effectiveness of neurofeedback. Neurofeedback for ADHD has been studied for several decades. The American Academy of Pediatrics has classified neurofeedback as a level 1 best support intervention for ADHD, placing it alongside behavioral interventions in terms of evidence strength. And that's a meaningful designation from a mainstream medical organization. Multiple randomized controlled trials have shown significant improvements in inattention, hyperactivity, and impulsivity following neurofeedback training. Research has also documented improvements in academic performance and parental quality of life measure. Does every study agree? No. And I'd be doing this topic a disservice if I said otherwise. But like any intervention, neurofeedback has its proponents and its critics in the research world, and the conversation about methodology is ongoing. What I can tell you is that the evidence base is substantial and growing, that the approach is non-invasive and carries no pharmaceutical side effect, and that the families that I work with who commit to the full protocol consistently report meaningful change. If you've been searching for an approach to your child's ADHD that goes beyond behavioral management, that actually addresses what's happening in the brain, then I want to invite you to take the next step. At Anchor of Hope, we start with a free ADHD Clarity call. It's a 15-minute conversation where we talk about what your child or family is experiencing and walk through what the assessment and the neurofeedback process looks like. We also determine together whether this is the right fit. There's no pressure and no commitment, just clarity. We work with families nationwide through our fully remote telehealth model, and Florida families with children enrolled in the Step Up for Students FESUA scholarship may be able to use those funds to cover neurofeedback services. So if this video gave you a clearer picture of what neurofeedback is and how it might help your family, then I want you to please share it with a parent who is exhausted from trying strategies that don't address the root cause. Also share it with a teacher, a school counselor, a pediatrician. The more people who understand how the ADHD brain actually works, the more children get the support they deserve. Thank you for being here. And thank you for being a part of our community. I'll see you in the next video.